In the past, we had a lot of negative trials in HCC, both in first line and also in second line. The last, or the first positive trial was with sorafenib, which was published in 2008. And a lot of investigators thought that treatment with sorafenib can clearly be improved with other tyrosine kinase inhibitors. And sorafenib was always considered as a really low-hanging fruit, as well as treatment in second line, where we only have best supportive cares. So it was really surprised that all these drugs that have been tested in the last 10 years have failed both in first line and in second line. And there are really numerous phase 3 trials and also a lot of phase 2 trials that were not able to be either better than sorafenib or compared to best supportive care. So the last 10 years were really extremely disappointing in respect to systemic therapies. But well, luckily now there's really a change and we have new drugs available. One of them would be regorafenib, and today we also have heard about lenvatinib. And I think there are more interesting studies to come with the immunotherapies.
Former times, to several years ago, we know that about 20 to 30% of patients who started local ablative treatment or local regional treatment finally received systemic treatment. So we lost a lot of patients. So of course this was probably it was also the fact that we didn't have that many treatment options for the systemic treatments. So we just had sorafenib, or even in former times we just had doxorubicin, which was not really effective in systemic treatment. That's why I think that the rates will increase. So we have new drugs which we can apply to the patients. We have several lines of systemic treatment, and we have the evidence that it's improving survival. So I think that the rates will increase. I think it will definitely be more than 20 to 30% in the future.
The unmet needs for systemic therapy in HCC are clearly that we need more drugs that we could use in our patients. So far, we were just able to use one drug, sorafenib, for all patients. We do not have any biomarkers that would identify patients that would benefit the most from the treatment, and we do not have any really effective second-line treatment, at least for the last 10 years. Now we have 2 positive trials that have been reported in HCC, and with that we have now more options and we can decide which drug it is the best drug for our patient, and we have to decide in which sequence we should use these drugs.